Welcome to our new trauma room. We've just completed the renovations. What we have is a boom, which was kindly donated by the foundation and by the Women's Auxiliary of Newcastle.
This is our triage space, so this allows us to triage patients as they enter the department. We can then determine their acuity and decide the appropriate bed to place them in within the department. This increases patient privacy and allows for department flow with all of the patients within the department. We have a doctor's dictation room here, so this is for the emergency physician. And as we move into the emerge, there's 4 emergency department bays across. Each bay is set up with Space Labs monitoring. We can then have 4 different patient monitoring going on within the emergency department. We have a central touchdown station for interdisciplinary collaboration, and it allows the nurse to monitor all of the patients from the central location. Moving on, we have what is called the visiting specialist office. So in here we have a space that can be used for outpatients, emergency department patients as needed, or also as a visiting specialist office, which allows for practitioners from out of the community to come in and offer services in our community for outpatients. In here we have a quiet sitting space for family. Should their loved one be in the trauma room, we can put the family into here. They can have a quiet space for confidential conversations with the physician. We have a big bay doors here that allows for BC ambulance to enter directly from outside of the building, and it also connects us to diagnostic imaging and lab.